that if there's anybody outside who is keen to come in for our crescendo session at the end of the day, now's the time to do it. It seems to have had an effect because they're a bit quieter out there than they were. Everybody enjoy their tea and those very tasty looking pastries. I see a few crumbs on faces, so the evidence is clear. We'll give it another minute just to get everybody in, and then we'll get cracking, because we did say we'd get you away on time. And time stands still for nobody. Are we all ready? Is everyone... Gwen, do you want to do a sort of rounding up out there? Thank you very much. I don't mind them interrupting me, Tracey, but I don't want them interrupting you. Right, listen, we're on schedule, I think, now, so we should get ready to get going for our final session of the day. Before we just dig into that, I hope that you've all had a great experience over the last sort of 3 hours or so in the workshops. I popped my head into probably 4 or 5 of them, but in total we had 14 workshops there, and certainly from the evidence and what I was hearing, we really were hitting the right tone in most of those. So make sure you reflect back on that and you put that into your evaluation forms at the end, or if there's anything we could have done better, that needs to be included as well. But now we have got a very special lady coming up onto the platform. I would like to introduce all of us to the slightly nervous but massively talented Tracey Franklin, who is going to be coming up on stage. Tracey knows, I've told Tracey she's with friends, so she's taken her high heels off for that reason, so she could get up onto the platform, because that's what you do when you're with friends, Tracey, isn't it? And Tracey, she lives in East Bruff, and Tracey and her husband Lee have got a son, Jack, with Duchenne muscular dystrophy. And for a number of years, Tracey, I'm not going to say much more because you've got the story, but she's been a fantastic ambassador for the charity, driving advocacy issues, working on fundraising. So please give Tracey an extra special welcome, and she'll tell you the story.
Hi, good afternoon, ladies and gentlemen. I'm Tracey Franklin, and my son Jack is 18-year-old and he has Duchenne muscular dystrophy. When Jack was... Sorry, there we go. There's a picture of Jack. He was only 3 at the time. When Jack was diagnosed at the age of 3, we'd never even heard of the condition, never know how debilitating it could actually be. He was just like any other child, happy-go-lucky. But unfortunately, we heard this news and it felt like our world had ended. Nothing was ever going to be the same again. And unfortunately, then I realised that's where my fight for services and adaptations and just the things Jack actually needed would begin. My first involvement with the charity... came because we actually went to, we found out there was no services at all within the Hull area. We actually made the decision to travel to Leeds, which is a centre of excellence for the consultant and the care that Jack really needed. When the Walton report was issued, it actually stated that children within the East Yorkshire area had an age of death of around 17 years, where elsewhere in the country it was actually 30. I found this absolutely diabolical, and I thought there is something that needs to be done to make all of the United Kingdom as one. So every child within any area receives the same level of care and services they'd require. I then went to the Houses of Parliament, where I met the specialist commissioners, and I asked her what she was going to do personally to ensure I had more than 4 years left with my son. At that point, they issued a new care advisor within the Hull area, and which has been an extraordinary, fantastic help to all families. And I'm sure you know, if you use your care advisor where you are, how fantastic they actually are. Then the Yorkshire and Humber Muscle Groups was actually launched. I was part of that process as well, and with Brian Deenan, who's the chair of the Yorkshire and Humber Muscle Group, we go around the Yorkshire area, speaking to families and trying to decide what we can actually do for them. We go throughout Yorkshire, and it's on a 8-weekly basis. I'm also part of the Bridging the Gap Forum, which is funded by the Department of Health, and it's to retrieve good practice throughout the country. We discuss the gaps that affect actually patients and actually change and influence how the commissioners see patients that deal with muscular dystrophy. As I said, we have a new care advisor in the Hull area, which has raised actually throughout the UK from 12 to now 47 care advisors that are actually funded through the NHS, which initially was funded only by the Muscular Dystrophy campaign. Through Bridging the Gap, we've also a new online map of services called the Hub. All info is in one place, and it's services with all different details, like to leisure, wheelchair football, things that are around your area. I suggest you go have a look at it. It's absolutely fantastic, and it's so easy to use. And you can just put your postcode in, and it will tell you everything you need to know about what's available in your area. Also, as well, for newly diagnosed people, there's there you can go have a look at your consultant, see where they come from, what their training is, and also there's a picture of them as well, so you know who you're going to see before you actually get to clinic. The Bridging the Gap has also issued some training of health professionals around physio days and around the country, training specialist physios and giving advice on the muscle wasting conditions. There's a new specialist physio that's been actually appointed within South Yorkshire, and more to actually come, which is, as we all know, physio is really lacking, and it's a very important part of dealing with your condition on a daily basis, and physio is so important. We've also issued some emergency care plans for all conditions. These are to ensure that if in an emergency, you will actually receive the correct care that you require. For example, a boy with Duchenne muscular dystrophy, it is detrimental to them to have oxygen issued. Most care professionals don't understand this, especially in the ER. So this is a piece of equipment that you can utilise in case of emergencies. I'm also an Advocacy Ambassador. There's about 30 of us around the country. Anyone can get involved. We have training throughout our time on different levels. We've actually had some training with Hogan Lovell, which are the pro bono solicitors that you heard about earlier. They are just absolutely amazing. And with their help, the advocacy service run by the MD campaign has actually overturned £1.5 million worth of equipment and services that people like you in this room actually require on a daily basis. We don't want them, we actually need them. And why shouldn't you have exactly what you need? I also support and visit newly diagnosed families with the assistance of the care advisor. I also get referrals from OTs, physiotherapists and social services. They just need to speak to somebody that's actually been through what they're going through, who can actually physically relate to exactly how they're feeling. And I think being part of that is fantastic for me as well. I know that's a bit selfish, but I do get a lot from exactly what I do. I give support and information and anything they require. I then actually signpost any information that's, if they need extra assistance, to the advocacy team, who then get on with Hogan Lovell to see if there's anything that they can do. They will write letters on your behalf. I've had somebody recently actually contact me because he's having central heating fitted. It hasn't been done. Obviously, the cold weather's coming up. So the MD campaign have actually written to his landlord, and now that's getting fitted earlier, which is fantastic. Without that information, there wouldn't have happened. I actually fight for services and equipment for all of the families as well. Recently, a young boy, he's only 3, he needs the SAFers, which are out in the reception area, if anybody's had a look at them, to enable him to walk. Without this, he can't walk. The normal AFers just don't deal with him. I mentioned this at a Bridging the Gap meeting, where a commissioner was there. They'd actually already requested the SAFers and been turned down. Glad to say they've now been given the authority to get the SAFers on the NHS, which is going to save the family approximately £1,500, because that's how much they are every time. I've also been doing some training days for the physios and OT and the social services department around my area, just to assist them in how it actually feels being a parent with a child with Duchenne muscular dystrophy. So then they can actually go to newly diagnosed people and advise them in a better way to enable them to do joint clinics. So the physio and OT will go together, because we all know what it's like going to appointments day after day after day. If joint clinics are available, I think this is a good step forward. They also now are aware how it actually feels to be on the receiving end of the services they give. Also, my son Jack has actually gone to university. He's the first boy with Duchenne muscular dystrophy to go in the Yorkshire and Humberside region. He's living approximately an hour away, independently, with 2 carers. I'm just so proud of everything he's achieved. He passed his A-levels and he's entitled to go to university. And I just thought, why shouldn't he? It took so much research to actually put all the services and everything he needs in place. But it all went quite smoothly. I'm quite shocked, actually. I expected to fight for things, but I didn't have to. They realised Jack's potential, and there was people there to assist me. The Trailblazers did an actual information on university, which assisted me in looking at the correct direction in where I had to put my energies. It took about 18 months to get everything in place, but now he's there, and he's actually studying. He's independent, which is great for him, horrible for myself and my husband. We miss him dramatically, but he's absolutely loving it and having a whale of a time. Jack's also achieved so much in his life. He took part in the Olympic torch relay. He's actually been around a racetrack at 180 miles an hour, which was quite scary for me, should I say. Looking forward, we do need to continue to fight for better services and for families across the UK. There's still gaps in services that we all are aware of. You need to tell somebody about those gaps, otherwise nothing will ever change. I've realised that. Things have changed within the whole area. Wheelchair services are much better. Jack never even got his first wheelchair funded. Now, I understand that's not the case. Things are improving, and with your help, things can dramatically improve in the future. And lastly, I was shortlisted for an NHS England award because of all my participation within the Muscular Dystrophy campaign, Bex actually called me and said, I hope you don't mind, but we nominated you for an award, and I was so proud to be shortlisted to the top 5. Unfortunately, I didn't win, but I went to go to a lovely reception in Manchester, and also did loads of TV and radio interviews as well. I think if anybody does want to get involved, by all means, please feel free to come over and talk to me about it. Thank you so much for listening, and I do appreciate all your attention.